Hello everyone. My name is Felisha and my NPM is 3019. In this video, I'm going to explain about the Moyer's mixed dentition analysis. Okay, so for the definition, Moyer's mixed dentition analysis is a clinical technique used by dentists to estimate the future space available in a child's jaw for their permanent teeth that have not yet emerged. This method is particularly focused on predicting the space for canines and premolars during the mixed dentition phase, which is the period when a child has combination of both primary or baby teeth and newly erected permanent teeth. And for the purpose, why is it important? It is important to detect early signs of potential dental crowding or excessive spacing as the child's permanent teeth develop. By identifying this issue in advance, dentists and orthodontists can strategically plan and recommend timely interventions, such as orthodontic treatments or even necessary tooth extraction, which helps in managing and correcting dental problems before they become more complex or severe. And for the basic principle, uh, the foundation of this analysis is built upon a consistent relationship. There's a strong, there's a strong correlation between the width of the four permanent incisor in the lower jaw and the combined width of the canines and premolars that are still developing beneath the gums. By accurately measuring these lower front teeth, dentists can reliably predict the size of the unerupted posterior teeth, thereby assessing whether adequate space exists in the jaw for all permanent teeth to erupt into the correct position. And for the categories of the analysis, there are two categories. The first one is the radiographic method. This involves X-ray images to directly measure the unearthed canines and premolars. While this offer a direct visual reference of the teeth development, it requires specialized equipment and exposes to the patient to a small amount of the radiation. In contrast, non-radiographic method, of which Moyer analysis is an example, rely on measurement taken from teeth that are already visible in the mouth, most commonly the four lower incisor, to make prediction about the unerupted one. And for the how to perform Moyer's mix analysis in the mandible, to begin the analysis, the dentist first uses special tools to measure the width of each of the four lower front teeth, known as the mandibular incisor. These measurements are added together to get the total width. Next, the dentist determines how much space is needed to properly align this incisor by adding the width of the left central and lateral incisor and making this distance on the dental arch or a model. And after the incisor are accounted for, the next step is measures the space remaining for the canines and premolars on both sides of the arch. This is called the total space. We can see here in the right in the picture. Uh, This total space include the actual size of the visible front teeth or incisor, an estimate of how large the canine and premolars will be when they erupt, and any extra space needed to achieve an ideal bite where the back teeth fit together well, or class 1 occlusion. And then dentists use the Moyer probability table to predict the combined width of the unearthed canines and premolars based on the total width of the lower incisor. And finally, the available space in the arch is compared with the predicted size of these teeth. If the available space is less, crowding is likely, but if it is equal to or more, there should be enough room for all the permanent teeth to fit properly. And for the next one is how to perform Moyer's mix analysis in the maxillary. So it is basically the same as the mandible. It has this same steps. However, it is important to note that the prediction for the size of the upper canines and premolars still relies on the measurement taken from the lower incisor using the specific molar table design for the upper arch. Additionally, the dentist makes any necessary adjustment in the measurement if the upper front teeth significantly protrude over the lower teeth. As with the lower jaw, the available space is then compared against the predicted tooth size to anticipate either crowding or adequate spacing in the upper arch. And here is the example of the measurement. This is the example for mandible analysis. So to illustrate, uh let's see this example. If the combined width of a child for lower incisor measure 2022 millimeter, the dentist would locate this value in the appropriate column of the Moyer probability table. By then looking down the column to the 75% probability level, they might find a predicted combined width of for the canine and supremos of 21.4 millimeter. If after measuring the child actual inner arch, the availability space is only 20 millimeter, this discrepancy indicates that crowding is likely to occur. Conversely, if the available space measures 22 millimeter or more, it suggests that there should be ample room for all the permanent teeth to erupt without significant crowding. And for the conclusion, so this analysis is a practical, non-invasive, and reliable way to estimate if a child dental arch will have enough space for all permanent teeth by using the predictable relationship between the lower incisor and the unerupted canines and premolars. Dentists can plan early intervention to ensure healthy and well-aligned teeth as the child grows. And I guess that's all for me. Thank you for listening.